The IMMCA is privileged to recognize here today some of the best talents in the medical maritime fraternity who have served the sector for many decades. Mavics Media is proud to announce 25 years of excellence recognition to medical doctors whose unwavering dedication, exceptional skills, and profound impact in the field of medicine for over past 2.5 decades has been commendable. Their commitment to excellence, compassion for patients, and contributions to medical advancement have undoubtedly left a mark on the healthcare community. Their tireless efforts in advancing medical knowledge, providing outstanding patient care, and mentoring the next generation of healthcare professionals are truly commendable. The dedication to the pursuit of excellence in medicine is an inspiration to all of us. I am confident that their legacy will endure and continue for many generations to come. For doing the honors, I would like to invite on this Dr. Ilona Denisenko. Could you do the honors for us, ma'am? And I also invite Captain Kamal Chadha to join us on stage, please. Today we are presenting the 25 years service to maritime industry recognition to doctors working in the maritime medical field. May I invite on stage Dr. H.S. Bhatia to please come ahead and receive this recognition from Dr. Ilona and Captain Kamal Chadha.
I must first dedicate in the audience, nomination committee members of Indian Maritime Medical Conclave. I must congratulate Mavics for organizing such a function, conclave, where the PME has extended to such an extent that all the people have understood what we require and what we should do for our seafarer. Thank you very much.
Congratulations and thank you, Dr. Bhatia, for your immense contribution to the field. May we have on days Dr. Jagdish Mandani sir.
Thank you very much for inviting me today. It's a great pleasure meeting you all. I had a really good time, and I started my career in the year 1978 with watership management, and that time the medicals were very simple. You see, we had just a simple physical examination, VDRL tests, and just routine urine analysis for sugar and X-ray chest. And medical certificate was certified so and so is certified fit and he is fit for sea service. That is the thing. But now times have changed. It's over now. It's all electronic media today. And we have moved forward. That time VDL was very common. I've seen many seafarers with coming down with venereal diseases. We have VD, syphilis, lymphogranuloma, venereum. Then we had gonorrhea, and we had treated a lot of many cases of those times. But today, times have changed. People today, seafarers are, practicing, they celebrate. They don't, the incidence come down and venereal disease has disappeared from earth. I don't see any VDL test positively. All a change. Yes. This is what is happening today, and the seafarers are today they're buying things for their the wives and the children. They're doing shopping for them. The good old days they used to shop for their venereal disease. Now they are shopping for them. So now what has happened is the incidence of mental disease increase. So thank you once again very much. God bless you all. We'll meet again. Thank you.
I think the doctor that can make us laugh is the best doctor. Thank you, sir. May I call upon stage Dr. Vijay Belani. Sir, please. May we have on stage Dr. Jacob Matthew. Thank you for your immense contribution to the field, sir. We are proud to announce the honorary award from Marix Media for exemplary service to the medical fraternity to Dr. Girish Katagiri. Do we have Dr. Girish Katagiri here with us? I request Captain Kamal Chanda to take it forward from your side. And I request Dr. Ilona to remain present with us here on stage. Yes.
Friends, I have the privilege of reading out the background for the Lifetime Achievement Award. That is for Dr. Mohan Kopikar. Dr. Mohan Kopikar is a graduate of the prestigious SAITS GS Medical College and completed his MS general surgery in 1979 with distinction. He was trained at the KEM Hospital and Tata Memorial Hospital and was subsequently the assistant professor in surgery at KEM. KEM is King Edward Memorial, if I'm not wrong, till 1982. He worked in Bahrain and United Kingdom for about 12 years and he passed FRCS London examination in 1988. He was trained in minimal access surgery, keyhole surgery, that is, also called laparoscopy, in the United Kingdom. He has published many articles and presented papers in minimal access surgery. However, he decided to return to India to bring home the experience of such surgery and has been in practice since 1994. Dr. Kopikar is also known as the surgeon who refuses to operate unless necessary. He established the Department of Minimal Access Surgery at Wockhardt Hospital in Mulund, which now is a Fortis Group hospital. His patients include a large number of seafarers and celebrities, and he has successfully treated Shri Amitabh Bachchan. I definitely go to him. Not to Amitabh, Dr. Kopikar. So, I request, you're here already. So, I request Dr. Kopikar to please come up and receive his Lifetime Achievement Award. Please give a big
My greetings to all of you, and I've been very quietly sitting behind and listening to all your program, and I'm very impressed with the way you conduct your program and with so much welfare you are thinking of seafarers. I'm very impressed. And recently when my friend Dr. Matthew called me and said that I'll be honored with this Lifetime Achievement Award, my first thought was, do I really deserve this? But anyway, when I questioned him, he justified with his own criteria. Well, I have always functioned in the society in a way any good professional is expected to, and patient's interest is my top priority. I am grateful to your organization and the Seabird Medical Care for honoring me with this award. I shall receive this with gratitude and humility. It has been a great pleasure looking after the surgical problems of seafarers, and I have noticed that they are always very cooperative and trustful patients. I am very sensitive to all the problems seafarers face due to peculiar nature of the profession they are in, like long times away from family, their concern from the family when they are away from the family, the challenges they face, some due to the nature like high tides and weather and things like this, and many man-made like pirates and docking at ports which are unstable and corrupt countries and so on. I always, it's been my habit when patients come to me, I always take them a little lateral and discuss about their profession and their experiences, and it's always been very interesting to listen to them, and I've learned a lot of things in the process. And it has been my observations that since they are used to seeing so many or facing so many challenges and they overcome successfully, there's an extra level of inbuilt confidence in them in facing challenges on the land, and they have an attitude, come what may, we can face it. I am impressed with the kind of support the organizations give to seafarers regardless of the cost involved. Some years ago, I had come across a young man who had severe abdominal pain due to a very poor heart. He had cardiomyopathy, which had weakened his heart, and this was because of viral infection he acquired somewhere in South America. He was admitted to a hospital in America, and a lot of money was spent. I think he was there in the hospital for nearly 3 or 4 weeks. A lot of money was spent in detailed examination of that and coming to a diagnosis. And then he was brought back to India, and he was admitted under my care because he had severe abdominal pain. And then he was taken from here. He required a heart transplant, and he was put on this air ambulance and taken to Chennai. In those days, we had not started heart transplant, which that patient in fact triggered us to get into the heart transplant at Mulund and Fortis Hospital. So he was taken by air ambulance to Chennai, and he subsequently had heart transplant. And when I met his father a year ago, he was hale and hearty. So anyway, God bless all of you, and I pray for all seafarers, particularly in the very disturbed world today with all geopolitical problems. Thank you very much, and God bless you all.